Welcome. Today, we will learn about Enflor medicine. Enflor sachet 250, Saccharomyces boulardii, lyophilized for oral use, 10 powder sachets for oral use in sachet. It is anti-diarrheal. Saccharomyces boulardii is a non-pathogenic live yeast that has been successfully used for years in the prevention and treatment of diarrhea of various origins. Package contains. The box of Enflor contains 10 sachets of 250 mg each. It is also available in capsules. Composition. Each sachet contains Saccharomyces boulardii CNCMI 7545. 250 mg. Lyophilized. Excipients: lactose monohydrate, fructose, tutti frutti aroma, containing sorbitol, E420, anhydrous colloidal silica. The product complies with Hilton Pharma specs. Dosage: take 1 to 2 sachets twice daily or as directed by the physician. For further information, please see package insert. Direction for use: the powder of the sachet must be stirred into a glass of water, beverages or semi-liquid food and take it immediately. Do not mix Enflor into very hot or very cold drinks or foods. Due to a risk of airborne contamination, sachets should not be opened in patient rooms. Healthcare providers should wear gloves during handling of probiotics for administration, then promptly discard the gloves and properly wash their hands. Therapeutic indications. Enflor is indicated for the prevention and treatment of diarrhea of different etiologies in adults and children, such as acute infectious, viral or bacterial diarrhea in conjugation with oral rehydration, antibiotic-associated diarrhea, AAD, and treatment and prevention of digestive complication of antibiotic therapy, diarrhea, colitis, recurrence of Clostridium difficile disease, CDD, in addition to vancomycin, metronidazole, etc. Pharmacodynamics. Saccharomyces boulardii is an intestinal replacement flora, which acts as an anti-diarrheal microorganism in the digestive tract. It is anti-inflammatory, antimicrobial, enzymatic, metabolic, antitoxinic, immuno-enhancing activities which are beneficial when Saccharomyces boulardii is used to treat diarrhea of various origins, infectious, i.e. viral, bacterial, or non-infectious, in humans. Contraindications, known. Hypersensitivity to one of the components, allergy to yeast, especially Saccharomyces boulardii. Patients having a central venous catheter, critically ill patients or immunocompromised patients. Due to risk of fungemia. Drug interactions. Due to the fungicidal nature of Saccharomyces boulardii, it must not be administered at the same time as oral or systemic antifungal treatment. Warnings and precautions. You should not take this medicine if you have lactose intolerance. The sachet contains 471.90 mg fructose in each sachet. In case of frequent use or over a long period of time, e.g. for 2 weeks or longer, fructose can damage teeth. Patients with hereditary fructose intolerance, HFI, a rare genetic disorder in which a person cannot break down fructose, should not be given this medicinal product. Condition and population related. Diarrhea might be one of the symptoms of more dramatic underlying diseases in adults and in children over 6 years of age, if diarrhea persists after 2 days or if blood in faces appears or if fever appears. Treatment should be reconsidered and the necessity to introduce oral or parenteral rehydration should be considered. In children below 2 years of age, a medical advice is recommended. The rehydration dose and its route of administration, oral IV, should be adapted to the severity of the diarrhea and to the age and state of health of the patient. Pregnancy. Monitoring of pregnancies exposed to this medicine is insufficient to rule out any risk. As a precautionary measure, it is preferable to weigh the benefits, risks before using this medicine. During pregnancy. Breastfeeding. It is not absorbed. In the absence of data, it is preferable to weight benefit, risk before using it during lactation. Undesirable effects, side effects, rare, flatulence, unknown frequency, constipation, serious blood infection, sepsis in critically ill or immunocompromised patients. Very rare. Allergic reactions, pruritus, wheal formation, urticaria. Skin rash, either locally restricted or affecting the entire body, local or generalized exanthema. Swelling of the connective tissue of the face. Angioedema. Anaphylactic reaction or even shock. Fungemia in patients with a central venous catheter, in hospitalized and immunocompromised patients. Overdosage. Saccharomyces boulardii is not absorbed. There is no reason to expect in overdose. Instructions. Keep all medicines out of the reach of children. Protect from light, heat, and moisture. Store below 30 degrees Celsius. Product contains lactose. To be sold on the prescription of a registered medical practitioner only. Manufacturer and buy online. Enflor is manufactured by Biocodex. It is marketed by Martin Dow Pharmaceuticals, Pvt. Ltd. It is available online or you can buy it from any nearby pharmacy. It is available at the retail price around 780 rupees. Thanks for watching. Take your medicine as your doctor or pharmacist prescribes it.